acne is literally one of the commonest conditions that we treat in a dermatology office in young people. So once someone hits puberty, there's some hormonal changes which occur in the body, and these hormonal changes induce what we call the sebaceous glands, which are basically the glands that produce sebum, or what we call oil, on the skin. So once you reach that age, then you do tend to have increased production of sebum. That's one of the factors that contribute to development of acne. The other important factors come with inflammation and some bacteria which are sometimes found on the skin, which can also contribute to that inflammatory process, and then you end up developing what we call acne. Acne also has different types, and if you visit your dermatologist, he can be able to explain to you which category of acne you have and therefore manage it. That's a good question. So when it comes to causes of acne, most often than not, the people who get acne are people who already have what we call seborrheic skin. Seborrheic skin means that you have a lot of seborrhea, or production of sebum in those areas. So for instance, if you have, there's some areas of the body where you have more sebaceous glands than others, for example, your forehead, your chest, and those are the areas that tend to be affected by acne the most. Stress does contribute to development of acne, definitely. Reason being that there are what we call stress hormones in the body. So when you're undergoing a lot of stress, there's some hormones which are produced, and these hormones also stimulate your sebaceous glands, and this can lead to development or exacerbation of acne. So the best way to diagnose acne is just a quick visit to your doctor or to your dermatologist, and they can be able to tell you that you have acne. The nitty-gritties of acne, there are different types of acne, and this sometimes dictates how we manage. So the best thing to do is to see your doctor, and they can advise you further. When it comes to treatment, just like any other thing on the skin, everything that you put on your skin matters, starting with the kind of soaps you use, the kind of moisturizers you put, the kind of makeup you use. All those things contribute, even though they don't necessarily bring the acne. So when we're looking at the treatment, we want to address all these things, the products. For some people, they can have exacerbations of acne due to diet, sometimes due to medications that they're taking. So when it comes to treatment, once we factor all this in, there's some basic medications which we use specifically for the acne itself, such as topical medications to apply, or sometimes we can give you a prescription to swallow. And then in addition, if you have other risk factors or other issues such as hormonal issues, then we may add other treatments as well. So I wouldn't say there's a specific regime that you should use, but if you have acne, what I would suggest is that you try and go for products that are friendly to acne skin. This means that for some companies, they may write it's non-comedogenic, which basically means it does not have innate ingredients that make the formation of acne easier. So it doesn't mean that if you use the products that are suitable for acne, it will treat your acne. It means that it will not make your acne worse, and that's just the bare minimum of how we start managing acne. So you can always look for or ask your doctor to advise you on products that are non-comedogenic for use. So picking the right product is a tricky process because there are so many products in the market. Sometimes you don't know who's making them. But I would say a safe thing to do is to make sure that first the product you're using is approved by the Kenya Bureau of Standards. The next thing you can do is, if you're in a position to consult a skin specialist who can advise you on what types of skin products are best for your skin, that would be really helpful. If you're not in a position to do that, then if you know whether your skin is oily or dry, then you can try and select products which have those specific needs. And if you don't know anything about your skin and you just want a simple product to use, then simply go for the general use products. So that would be something like a soap, that would be a moisturizer. Just try and go for products I say that are for normal skin.